Dr. Jodie Guest joins me now. She is the professor and vice chair of the Department of Epidemiology at the Rollins School of Public Health at Emory University. Dr. Guest, welcome. How might COVID antiviral pills like Pfizer's alter the course of this pandemic?
Well, today was a fantastic day where we saw the emergency use authorization of Paxlovid come out. And this is our first antiviral that we have for COVID-19. So it's a big step forward. This is going to change the way we can treat people at home who are at potentially high risk for severe outcomes from COVID-19. It has a couple of special places it needs to be used, and we need to know that people have COVID-19 pretty early in their symptoms in order to be able to provide this, but a big step forward today.
Well, what do we know about the efficacy of Pfizer's antiviral pill in fighting different variants?
So what we have seen from the data, it is about 90% effective at keeping people who are at risk for severe COVID-19 from needing to be hospitalized or even dying of COVID-19. Those are big numbers, and so very exciting. It's going to do a couple of things: keep people out of the hospital, which we desperately need to keep our hospital system safer and working at high capacity the way they've been doing so much good work with over the past year and a half. It will also, the data really show that it prevents deaths in people who are at risk for severe complications from COVID-19. So very promising. As far as those who are at what we call normal or standard risk for COVID-19, we see about 70% protection from keeping people from people needing to go into the hospital or of dying from COVID-19.
Well, Europe is implementing lockdowns in response to this COVID surge. That's different than the course the U.S. has chosen. After nearly 2 years of this pandemic, Doctor, what do we know about the merits of those differing approaches?
I think we've seen lots of different approaches across the world. Japan has a very different type of approach. We're seeing most of Europe, or a lot of Europe, putting some form of lockdowns back in place. I don't think we're going to see much of that in the United States. That's not been the way the leadership in this country has moved us forward. But we are seeing things like particular municipalities or cities are putting masks back in place. We're seeing schools decide, particularly universities, that they need to do virtual school for the first couple of weeks after people will have been home and traveled for the holidays. So I think you're going to see a variety of approaches across the United States. What we know is that the vast majority of the United States, 92% now, are at high or sustained spread. And that means when you're in places of public spaces, you do need to be wearing a very good mask, as well as making sure that you find your way to a vaccine and a booster.
Well, AAA estimates some 109 million Americans will travel over 50 miles between December 23rd and January 2nd. That's a 34% increase from 2020. Now, many officials say we should brace for another wave. What do you think is the best case scenario with so many people traveling?
Well, I think that we were all hoping for a much different holiday than we saw in 2020, and it is different. So much vaccination is going to protect us. And while we're at high vaccination rates, about 71% of the United States has seen one vaccine, we are not at a fully vaccinated level that we want to see. So I think a lot of people planned for travel over the holidays when we saw the Delta surge coming down. And Omicron is not what we wanted to see happen during the holidays, but it is here and it is spreading rapidly. So with our travel and our connectivity that we anticipate seeing with the holiday season, I do believe we will see continued increases in numbers through at least the middle of January, if not further.
Well, the majority of antibody treatments do not seem to be effective at battling the Omicron variant. Do we know why?
Yeah, so the changes in the spike proteins and other mutations with Omicron variant are just not doing well with the monoclonal antibodies. And so what we're seeing in a lot of publications that are just starting to come out is that it does not appear that monoclonal antibodies are going to work well against this variant, and that is very disappointing news.
Well, while the Omicron variant is spreading at unprecedented speeds, COVID numbers are dramatically dropping in Japan. So, Doctor, what might that suggest?
So Japan has taken a very unique approach to their prevention for COVID-19. They've done what's something called cluster strategy, where they are interested in tracking individual cases and finding where those people have been and making sure that they're closing large venues where people get together are in close contact, singing or talking. So karaoke bars and restaurants and clubs and things like this, workout facilities. And so they have done a very targeted approach to finding each case and then finding all the clusters and contacts that come with that. It has been very successful for them. They are down to only 12% of the cases that they saw in April when they were at their peak. But it's been a very unique approach and very different than we've seen from any other country.
Certainly very different. All right, Dr. Jodie Guest, doctor, thank you very much.
Absolutely. Thank you for having me.